The Catholic Church teaches all forms of contraception are intrinsically evil because contraception is not open to life and it prevents a couple from total gift of self. This next story shows the Church's wisdom in that. The pharmaceutical company Bayer recently announced it will stop selling the permanent contraceptive implant Essure in the United States, the one country it remained available. The sterilization device, Essure, consists of 2 nickel titanium coils that are inserted into a woman's fallopian tubes, creating scar tissue which blocks sperm from fertilizing a woman's eggs. Many women have cited negative side effects from the insert, and more than 16,000 U.S. women are suing Bayer over Essure. Some patients have experienced or reported adverse effects, including perforation of the uterus, perforation of the fallopian tubes, persistent pain, among others. But Bayer insists Essure is safe, and they are only pulling the sterilization device from the market because of weak sales. Joining us now is a woman who has been fighting for years to get Essure pulled off the market. Amanda Dykman is Vice President of Advocating Safety in Healthcare E-Sisters, or ASH's nonprofit. She's also the head research coordinator and administrator of Essure Problems. Amanda, welcome to the show.
Thank you. It's good to be here. Thanks.
First off, can you tell us, you had the Essure implant. What side effects did you experience when you first got it?
When I first received the Essure implants, I immediately noticed a change in my weight. I gained weight instantly. I suffered from debilitating migraines, bloating, chronic fatigue. It was a really rough time for me. Depression. A lot of the complaints you've seen from other women, I suffered from.
And as you mentioned, you haven't been alone, right? How many other women that you know of have experienced negative side effects from Essure?
It's hard to get an exact number because the manufacturer hasn't been very good at keeping track themselves. But on our Facebook page alone, we're now approaching 40,000 women. Just since the debut of The Bleeding Edge on Netflix on July 27th, we've added over 1,500 members to our support group. A majority of those joining are women that have, suffered from complications after receiving the Essure devices, and are, a lot of them have already had hysterectomies. They're just putting the dots together. So it's really difficult to say exactly how many women have gotten this device, but I can say it's one too many.
And Bayer, as I know that you know well, finally announced in late July they are going to stop selling Essure. This is something you and your group have been pushing for years. Can you give us a better idea as to what was going on behind the scenes to make this happen?
It took years of lobbying on our part. The FDA was not listening to us. Our own doctors were not listening to us. We took our voices to Congress and we knocked on doors until someone would listen. And finally, a congresswoman out of Connecticut was able to get us a meeting with the current commissioner, Scott Gottlieb, with the FDA. And after meeting with him, they put a strict restriction on the devices, which kind of limited the sale of Essure to physicians that agreed to follow the protocols and labeling. And after that, Bayer finally said, we can't sell this product, so we're going to pull it from the market starting in December of this year. We have concerns about it should be pulled right now. We're concerned that physicians are going to be unloading their current stock. We have people joining the page saying they're being told that Bayer is not accepting any of the Essure kits back. So what are physicians going to do with those kits but try and unload it on unsuspecting women? We have seen a lot of women joining saying they were not told of the warnings and were just implanted last week. So we're afraid for them, and we feel like it should be pulled right now rather than wait till December.
And Amanda, as you mentioned, you were featured in the new Netflix original documentary, The Bleeding Edge, which examines the $400 billion medical device industry, and it did examine Essure. Based on your experience working and lobbying in the medical device industry with Essure, how do you think the medical device industry views and treats women?
Very unfairly, Catherine. I feel like our pain has been dismissed. Like I said in the film, we're disposable, particularly when it comes to products like Essure that they can make a lot of money doing over, older procedures. So it's been very difficult to watch so many women going in every single day and trying to find a doctor that will help them remove a device that has caused such horrific damage to their lives, to their bodies, to their livelihood. It's something that needs to be addressed in this country.
And Amanda, what are the next steps? What are you going to focus on now?
Essure Problems and Ash's nonprofit is not going to stop with Essure. Through this whole experience, we've noticed a blatant oversight and regulatory issues when it comes to all medical devices. So we partnered with The Bleeding Edge to create medicaldeviceproblems.com, which we feel will be a great resource for patients to go to when they're seeking answers, doing their own research and their own due diligence to figure out if a device is right for them, or connect the dots if they feel like they might be experiencing adverse events from a device.
Amanda Dykman, thank you so much for sharing your insight with us.
Thank you, Catherine.
I did reach out to Bayer for comment. Bayer said stopping the sales of Essure was a voluntary business decision, that it was not a recall or safety situation, and they are working with the FDA for a slow wind down process.